Okay, we're just going to give it another second. We're still admitting folks in. All right, let's get started. Good morning, everyone. I'm Hartford Healthcare's Tina Verona. Thank you so much for joining our media briefing. What a night it was last night. It was a historical night here at Hartford Healthcare, where just literally minutes after the CDC approved the vaccine for ages 5 to 11, we started administering the vaccine to folks. Joining us, we've assembled everybody that was there last night with us today to give you another opportunity, if you weren't there last night, to ask them their questions today. So I'm going to just give you a brief rundown of who we have joining us. We have Keith Grant, APRN, our Senior System Director of Infection Prevention at Hartford Healthcare. We also have Eric Arlia, our System Director of Pharmacy, with us. And we also have two parents of one of the first children in the country to get vaccinated. We have Reem Noah, and we also have Nadia Woodman here as well. So as we get started, we're going to do brief introductions, and then if you have questions, please ask them in the chat. That way I can ask them to the appropriate expert or to the parent in the order that we receive them, and we make sure that we get all your questions answered. So for now, I'm going to turn it over to Keith Grant. Keith, you want to kick things off?
Yeah, absolutely. As Tina said, I'm Keith Grant, Senior Assistant Director for Infection Prevention at Hartford Healthcare. And Eric and I have discussed this a few times since last night, how much, we feel like we've done this before, but last night felt just a little bit different. COVID-19 has been difficult on everyone, but I think particularly on kids. So every opportunity we get to bring kids back to a normal state is a very, very good thing. And if, one of the questions that I've gotten over the last 24 hours is the science and the decision-making process seems to be more detailed than in any of the previous approval processes. And it wasn't. It was now people are now having an understanding what the CDC and the FDA and the scientists that are around reviewing the trial data, the clinical trial data, and administering that significant input. And finally, to get the CDC director's sign off was a monumentous occasion for science and for the pediatric population. So at this point in time, we do have 28 million individuals, pediatric individuals, 5 to 11 in the country that are now eligible from last night onwards, that is eligible for the Pfizer vaccine. And I'm sure we'll hear more as the time goes on, as other companies such as Moderna review the opportunity to add to that inventory of vaccines. But again, a monumentous occasion on Hartford Healthcare, as always. The promise in the beginning of this from Tina and her team and Rebecca and everyone is to ensure that we get information out to our community. And for Hartford Healthcare, our promise is to ensure that we create a platform of access, a platform for the appropriate information, a platform where you can ask questions, a platform that we can continue to deliver world-class care. So I will pass it on to Eric, but as I said before, monumentous last night, and I can't be more grateful for the kids that were there, such bravery and excitement. But I think for me, most profound thing for me is not just the bravery and excitement, but their understanding of the part that they're playing in this process and the impact that this will have generally and long term on their community and their ability to socialize. So Eric, anything to add?
Sure. Thank you, Keith. It was definitely an exciting night last night. I think we were all drawing off the energy of the kids after a long day. We've all learned so much about the approval process for vaccines over the past year. It's really a 4-step process when you think about it. There's an advisory committee for both the FDA and the CDC who always weigh in, and then the agencies themselves have the final clearance on both sides. So waiting for that 4th step, we knew it at 5 o'clock last night that the ACIP committee had unanimously voted to approve the vaccine for all children aged 5 to 11. We weren't sure when Dr. Walensky would sign off, but we wanted to have that opportunity to have a first event if she did it early enough in the evening. So I appreciate everyone who was there with us last night. It really was a fun and exciting thing to be a part of. Like I said last night, I've been at these all of these firsts with Keith and with Colleen Teven, our pharmacy clinical manager who did the vaccinating last night. It's a very special event, and obviously doing it for kids in this age range was probably the most memorable, along with the first one of all of them. So just a little bit of information on the vaccine itself. Yesterday, 5 hospitals in Hartford Healthcare received a total of 3,000 doses of the pediatric vaccine. Most of that vaccine we obtained yesterday is for a planned event that we will be doing at 5 of our hospitals and 1 of our healthcare HHCMG clinics in Wethersfield on Saturday, November 13th, where we will have clinic time from 12 to 4 for the public with children between ages of 5 and 11. That's our primary plan for having an initial availability of vaccinations. We're not a specialty pediatric health system, but we do have some people in our system that have dealt with pediatrics or deal with it in areas like the EDs and the ORs where we see all different age groups. So we're able to provide that. A couple of other things that we're doing that are worth noting. We also have some of our medical group offices around the state, approximately 10 of them, who will offer the pediatric vaccine in the near future on a routine basis. And then the third thing that we're planning to do is for any pediatrician that's part of our health system alliance known as Integrated Care Partners, we are planning to support them if they are able to do, if they're interested in doing the vaccine. They may or may not need our support. This vaccine is a lot easier to manage. It's good for 70 days in the refrigerator, and you can order as few as 300 doses at a time. But if there's any practices in our system, pediatrician practices that want to do smaller than 300 doses, then we will break apart the vaccine and supply it to them. So that's kind of where things stand. Our appointments for the event on the 13th should be posted on hartfordhealthcare.org no later than Friday of this week.
Great. Thanks, Eric, for that update, and Keith for that update. We do have some questions coming in from the media, but I do want to give our parents an opportunity to speak, to talk about their thoughts last night and how their children are doing today.
Thank you, Tina. Just to build on what Keith and Eric said, I mean, excitement was definitely the theme of last night. Ever since the COVID vaccine got approved, even for adults at the very beginning, my 7-year-old son, Kareem, at the time was just like, do I get it? And then when, my husband and I got it, he's like, well, what about me? And then his sister, who is 14, when her age group was eligible, she got it, and he's just been asking and to Keith's point, very aware of what this, why it's important. And what he was very excited last night. Couldn't believe it. I didn't tell him right until before we knew, and he just gave me the biggest hug. He went to school super excited today. He's going to tell all his friends. I'm hoping that all the kiddos from last night are an inspiration to their friends and families, and to their communities, so that we can all get past this. But we're just beyond grateful and excited.
Thanks, Reem, for sharing that. And Nadia, do you want to share any thoughts? Do we have Nadia?
Hi.
Can you hear me?
Can you hear me?
There she is. Nadia, do we have you? Okay, we're gonna effort to try and get Nadia back, but in the meantime, let's start with the questions that are coming into the chat. Our first question is from Jordan Fenster from First Connecticut Media. Can you comment on expected turnout? Are we expecting parents to get their kids vaccinated en masse? Eric or Keith?
I mean, I can tell you, in the beginning of all the approval process, in the beginning of, once a vaccine has been approved, we've had significant turnout. So we've had significant questions, and we have a need to educate, obviously. And in the first few days, we've always had significant turnout. I do think it's going to be slightly different in this sense, wherein we'll have significant turnout and it will taper off. The response that we've gotten so far, it seems like a lot more people than even I expected is interested in getting their kids vaccinated as soon as possible. Again, we will support this as much as we can. At current, we have 2 clinics scheduled, but as always, if we need to do more in order to facilitate the need, we absolutely will.
Okay, great. Our next question is from Tracy O'Shaughnessy from the Waterbury Republican American. So how many kids did you actually vaccinate last night? Any reactions?
Well, last night we vaccinated 7 children. Just of note, there's 10 doses in a vial, and the vial is good for 12 hours after reconstitution. So we were able to vaccinate 3 more kids early this morning, so we didn't waste any doses. I mean, I would say I think all the kids did a really great job last night. Certainly there were no reactions while we were all together. I don't know if the parents on the call have any additional feedback to add to that, but usually after dose 1, that's of all of the doses, that's the least likely to cause the adverse reactions.
Reem, do you want to respond?
Yes, no, there was no reaction. I even checked in with him again this morning, and when he was fine. He said, and when he got it, he said it didn't hurt. And this morning he said, I kind of feel something, but he was his self. He was perfect. So.
Great, thank you. And Nadia, do we have you? Do you?
No, my 2 daughters got vaccinated last night and they were feeling great this morning. They were feeling good.
Excellent, thanks, Nadia. Tracy from the Waterbury Republican American is asking, Tina, could you provide more specific information about that event to us through email? Yes, the event that Eric Arlia was talking about, we will definitely make sure that you have all the information about that. Our next question comes from Jenna Carlesso from the Connecticut Mirror. When will Hartford Hospital begin scheduling appointments? The website says you're not doing it at this time, and how will parents be able to sign up?
So we're hoping, we're planning to have those appointments available by Friday of this week. You'll be able to get information right off the main webpage, hhchealth.org. You'll be able to follow a link from there to the schedules for the event on the 13th. We are doing it by appointment only, and there's a couple of reasons for that. We have a limited amount of vaccine. We ordered enough vaccine for the event on the 13th, plus to get our medical group practices started that are going to be doing some routine vaccination. I don't think that we're going to have supply issues with the vaccine, but we were asked by the state in our first order to really just only order for events that you're planning to do in the first 2 weeks. So we have to limit the number of appointments that we'll have. And we also want to keep the flow, not have bottlenecks, especially with the kids. So by doing it by appointment, there'll be a certain number of slots every 10 minutes. So, no matter what time of day you come, the line and the time that it takes to go through the clinic should be about the same.
Follow-up question from Tracy. Does your support for your pediatricians mean you will supply your pediatricians with the vaccine?
Yes, so as I mentioned, with the PD vaccine, they could order as small an amount as 300 doses directly from the state. If that's too many for them, we can break that down like we do today for a lot of our medical group practices. We can break the vaccine down, and then the other thing that we receive are supply kits, which has the vaccine cards, needles and syringes, gloves, alcohol pads, etc. So if we get a box that has supplies for 300 intended for children with the smaller size needle and syringe, we'll break that down into a smaller amount if there's a pediatric practice that wants to participate but does not think that they'll use 300 doses within 70 days.
All right, thanks, Eric. We have a question coming in from Eliza Fawcett. She's with the Hartford Current. Could either of the parents on the call give some insight into their decision to vaccinate their young kids? Nadia, Reem?
Do you want me to start?
Sure.
For us, there was no decision. I mean, it was the only way. It was always, like I said, we've been on countdown. We've been waiting for this day. I don't see it any different than we vaccinate our kids as they grow up to keep them safe, from disease. And I'm also a pharmacist, so maybe that helped a little, but I believe in the science, and yeah, like I said, Kareem's feeling great. So I encourage all parents to do it.
And Nadia?
I completely agree with what Reem was saying. I don't think there was any question in my mind if I was going to get them vaccinated or not. And we've been waiting for this day. I think my daughter asked me every day of when are we going to have the chance to get vaccinated, to get back to some normalcy. We talk about the kids being resilient, and they've gone through so much and they've done an amazing job. But I think this brings them that much closer to going back to some normalcy. And you saw a theme in the kids last night of, being in the classroom and getting back to normal and being able to play with their friends. And I think this got us that much closer to that goal. And they're just really all excited.
Well said, both of you. I have a question for both of you. How difficult was it, through the pandemic, being a parent of children, being on Zoom, having them sort of sequestered, not being with their friends? Give us some insight to our media folks, what that was like parenting through all of this, and then this sort of culmination of last night, getting that shot. But talk a little bit about that process leading up to last night. Reem, if you want to go first.
Sure. Yeah, no, it was definitely a very hard time, right? It was parenting through that. My husband is a nurse. And so, and I was working from home and parenting, he was in kindergarten and then kindergarten to first grade, right? Because it's been almost 2 years now because he's in second grade now. It was just a very, very difficult time. It's very hard for a kindergartner to do virtual classes and learning to read during kindergarten and all those really important things. And then he's a very social child, and not having that was really impacting us and him. And trying to do Zooms and calls and him coming in to ask questions. Hey, can I have a leg? Can I play with this? So it was just a very difficult time for all of us, and impacting us. And there was always the fear, because my husband worked in healthcare, and him coming home it was still early on. It was very, very, very hard. So that was a hard time to live through. And as we learned more, it got a little easier, but never, that easy. And he always felt like, well, what about me? And when can I get? And we put travel plans on hold, all of that. And just last night, it's like, okay, when are we going to plan our trip? And things just are very optimistic. So again, very grateful.
New beginnings ahead. Nadia, anything to add?
No, I completely agree with Reem. It's been a challenging 2 years, and as resilient as these kids are, they just wanted to be back in the classroom. They wanted to be with their kids. They wanted to experience their life being in the classroom and being back in school and being able to see their relatives safely without worrying if they were going to spread it or they were going to get them sick. So it has just really made all the difference in the world.
Thanks, Nadia. We have a couple of other questions coming in from the media, but I do want to ask Keith, if you can, I really want to talk about the science behind the vaccines. I think that's critically important for people to understand the science behind the vaccines. Some parents out there who might be on the fence about this. So I really want to delve into the science behind the vaccines, if you will.
And I think, one of the good things that's happened over the last few months is the fact that the education about vaccines and disease process, we've created a lot of infection preventionists and infectious disease experts in the community. Like, people are now more aware. And I think that's a very, very good thing. So it's a good opportunity for us to continue that. And when you look at the COVID-19 vaccine, it's not very different from the majority of vaccines that kids are getting every single day. So the basic process of a vaccine and what it does is a vaccine introduces a construct or introduces an opportunity for the body's immune system to recognize a potential pathogen coming in and prepare the body's antibody or prepare specific antibodies that will fight this disease process. So I've referred to it many times as preparing soldiers in National Guards or the Reserve, a very specific platform that you need to battle or defend the country against. This is how we prepare for it. And over time, if we think the threat is even more, we'll introduce more of that vaccination or that vaccine, and the body will develop even more antibodies. It's very similar to what the body does when it's exposed to the actual disease process. The big difference with the vaccine and the actual exposure itself, you're now controlling the actual dose and the volume that we do believe the body will do quite well with. Sometimes have some very small amount of side effects to include fever, pain at the injection site, some lethargy, which is very common with most vaccines. But again, it's because the immune system is recognizing the need to actually build the antibodies. And if you really, really look at this, you appreciate the fact that this is something your body does very naturally on a normal basis. Occasionally, diseases are so not just prevalent, but so dangerous to the body that we would like to ensure that the body is introduced to the disease before an actual exposure happened, and the body has the antibodies to prepare itself to defend itself. And, if we talk a lot about the mRNA vaccine and what the mRNA construct and concept does. I do believe at this point, it's very difficult for us to appreciate that level of advancement in science. But the mRNA vaccine, I believe that technology will not just prevail, and it's proven to be very effective, but I think it will play a very significant part scientifically in the long term where vaccinations is concerned and how the vaccines are delivered. And specifically for these vaccines, for the pediatric vaccines, the science is important. I think some of the most important piece of it is being acquainted with the trial data. Trial data shows, over 90% efficacy. And for us, for Eric and myself, when we talk about efficacy, the efficacy that we're very concerned with is not a lot of people says, well, Keith, there's people who get the vaccine and get the disease. What I'm interested in is if you get the disease process, you don't end up in the critical care unit, you don't end up needing supplemental oxygen, and even worse, you don't end up dying. And if you look at the data, statistically, it's a very significant difference between the population of individuals who get the disease, needing hospitalization, needing to be admitted, and unfortunately, some dying. There's a very significant difference between that group of individuals who are not vaccinated and the group that are vaccinated. So predominantly individuals that are affected from a mortality perspective right now are individuals who have not been vaccinated. So we continue to be very cautious about this. We continue to watch the science, but after, again, over 5 billion people have gotten the vaccine and the impact that it has on a global scale, I think it's time that we have a unified voice in appreciating the actual science and the actual impact, the safety and the efficacy of this vaccine.
Keith, thank you for that very eloquent response and the description. I really think the science behind this is the driving force, and it's important that people really understand that. We have a follow-up question from Jordan Fenster, Hearst, Connecticut Media. This is for Keith and Eric. What, if any, side effects are you particularly concerned about? There was some discussion at the FDA and CDC meetings of heart issues. Is that a concern?
Eric, I'll start and you could jump in. I think the heart issue that we saw in the beginning of the vaccine process, especially for young adults, and where we've seen in some pediatric population, very small amount, but we still need to be aware of it, is your pericarditis. And, it is very difficult from an epidemiology perspective. What we have to really look at is pericarditis generally in the presence of viral illnesses, especially for respiratory viruses, it's very possible. So it's a high, I shouldn't say high probability, but it's something that we've seen even before COVID-19 vaccine. Now, the concern is there long-term impact? At this point in time, we have not had any documented long-term impact on individual who actually had pericarditis after exposure to the vaccine itself. The other thing that we haven't been able to conclude on is the presence of individuals getting the vaccine and then have pericarditis, did they have any presence of COVID-19 before? And that's a possibility as well. What we do know is, and the discussion was, very, very clear over the last few days, is any risk that we've seen with it, if you look at the actual numbers itself, it significantly outweighs, the benefit significantly outweighs the risk. It's a population, and again, I said it last night, it's a population that we know does very well with the disease, but we do have a number of kids, unfortunately, that's been hospitalized with this disease. And even more unfortunate, we have kids that's died. So it's something, we still need to be very, very clear about. Pericarditis that we've experienced within this disease, within the vaccination process, have not had that level of impact.
Tracy has a question from the Waterbury Republican American. I've heard other kids fearful of things like their fertility or heart problems. How was Reem's son not affected by that?
I think, again, like Keith said, the benefits outweighing the risks. Like when we first got vaccinated, he said, "What do you mean I can't get a vaccine? You want me to get COVID?" So there was always that fear of like COVID being like this thing we don't want to get, that it can get people very sick, that it can lead to all this other things. And so for us, and really think about it, any decision we make as parents, there's always risks and there always are benefits. And you just have to kind of think through that. He wanted this vaccine. We talked about, how it works. He was very curious about that. And that was not a concern to him. It was always, I want to get the vaccine as soon as I can.
Great. I don't see any other questions in the chat. At this time, we can kind of just do some closing final thoughts. Keith, do you want to start first?
Yeah, absolutely. So, it is currently in the US, where now there's 94% of our population that's eligible for vaccination. If you look at the uptake of the vaccine so far, it put us in a different position than we were last year. And, we strongly believe with the efforts of, social distancing, masking, and so forth, the vaccination process has been pivotal. If you compare states like Connecticut and where Connecticut is right now compared to other states that haven't adopted as quickly, you could see the difference in mortality, the difference in prevalence as well. Additionally, the question arrived many times in the beginning of this is where efficacy is concerned and safety is concerned. We're still having that question. So from a safety perspective, we continue to monitor all our patients that's been vaccinated. Hartford Healthcare has delivered over 600,000 vaccines in the past months. And we continue to monitor our patients along with the CDC and the FDA. We continue to appreciate the safety aspect of the vaccine. We continue to appreciate the efficacy of the vaccine itself. The last thing I will say is one of the most important piece of this is education and educating yourself, but not just educating yourself, but passing the education on to others. It is very, very important for us to appreciate the time that at this point in history, the part that we will play or we've played in order to mitigate this pandemic. I don't think, at least I really do hope, we don't have to experience anything like this before, anything like this again. But most importantly, we've hopefully learned that by coming together and appreciating science, by educating ourselves, by providing education for each other, by working with our community, by collaborating, not just as a health system and not just as a community, but full scale collaboration, we can definitely move forward.
Great.
Thank you, Keith. And Eric, final thoughts.
Yeah, thinking about where we're heading now, one thing I want to stress is, I feel like we will not have any supply constraints with the pediatric vaccine. If you think back to what we've done over the last year, there were many periods of time as we were adding age groups on where, supplies were scarce and, there were a lot of complexities related to that. I feel like this can be a much more, planned and orderly type of a rollout. I think if I remember correctly, we already have 22 million doses of it produced, and there's only 28 million children available. I do know they need 2 doses, but I don't think there's going to be any supply constraints. We'll be watching closely here in the state of Connecticut, making sure that access is not an issue. As I said before, we're going to be supporting about 10 of our medical group sites and any of our ICP pediatric practices interested in vaccinating. We'll have our event at 5 of our hospitals on the 13th, and then the follow-up will be on December 4th. I know there's a lot of, the state is also working hard to make sure there's a lot of access points for the vaccine, but, we've played an important role in that, and we will be monitoring the situation closely and doing whatever we can to make sure that that is not a concern.
All right. Thanks, Eric. And final thoughts from Reem and Nadia. Reem, go ahead.
Just very grateful, just a lot of gratitude, and, just thankful. It's been a really long journey. I think as a state, we've done really well, and we should be proud of ourselves, because again, it takes all of us to get there. I hope we continue that. I urge all of parents out there, help get your kids vaccinated, because if they can all be vaccinated, then classes are going to go back to normal, and teachers and kids and that interaction that they just don't have right now. We need to get back to that. So hopefully we can soon.
Thanks, Reem. And Nadia?
Great. I'm just truly feeling so blessed and grateful that we're getting back to some normalcy, and just encourage parents to talk to your children and try to get them vaccinated and get back to some normalcy.
All right. Well, I want to thank Reem. I want to thank Nadia for bringing your children in last night. It was really a historical night. It was proud once again to sort of see history in the making, and to see all of this unfold right before our eyes, and the excitement and the jubilation that was in that room. And of course, to have Eric and Keith with us throughout this entire process, of course, with their expertise always at the ready. We are so grateful and so appreciative. We hope we've answered all of your questions today. This is a big topic. It's an important one. And if you have any additional questions, we, of course, are always here for you. But in the meantime, thank you so much for joining us. And for now, be well. We'll see you all again real soon.